Festus, how are you doing today?
Lydia, good morning. I'm not fine at all.
What happened to you? Why are you sounding like this?
My father having diabetes, and someone said he is going to die soon.
Ha 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 ha.
What is the meaning of this act? I'm telling you what is paining me. That created a sadness mode for me and you are laughing seriously like this.
That is not true, it is nothing but a big lies. Having diabetes is not sentenced to death, it's only call for proper management.
How will that be possible?
Festus, stop crying, you don't need to do this. See, I am going to a health management class now.
Health management class?
Yes, the class has been organized by Gracelanddiabetesfoundati and it will be tutored by an international trained professional diabetes specialist. Festus, I would like you to go with me.
Okay, Lydia, thanks for your words of encouragement.
You are welcome, my dear friend. Let's go.
Good morning, everyone.
Good morning, sir.
I welcome each and every one of you to this class. For the benefit of those who are attending this class for the first time, my name is Mr. Nelson and I will be teaching you diabetes management.
Thank you, sir.
Who can tell us what is diabetes according to what we learned from the last class?
Sir.
Okay, please tell us.
Diabetes refers to a group of conditions characterized by a high level of blood glucose, commonly referred to as blood sugar. Too much sugar in the blood can cause serious health issues.
Thank you for your brilliant answer. I am very proud of you, Lydia.
Thank you, sir.
So, let's go straight to the study today, which is type 1 diabetes. We are going to study the following. 1. What is type 1 diabetes? 2. Symptoms of type 1 diabetes. 3. Signs of an emergency with type 1 diabetes. 4. Causes of type 1 diabetes.
Written, sir.
I want every one of you to be more attentive. What is type 1 diabetes? Type 1 diabetes is a condition in which your immune system destroys insulin-making cells in your pancreas. These are called beta cells. The condition is usually diagnosed in children and young people. Therefore, this is called juvenile diabetes. A condition called secondary diabetes is like type 1, but your beta cells are wiped out by something else, like a disease or an injury to your pancreas, rather than by your immune system. Both of these are different from type 2 diabetes, in which your body doesn't respond to insulin the way it should. I believe you all understand what type 1 diabetes now?
Yes, sir.
Okay, let's continue. Symptoms of type 1 diabetes. Signs are often subtle, but they can become severe. This includes 1. Extreme thirst. 2. Increased hunger, especially after eating. 3. Dry mouth. 4. Upset stomach and vomiting. 5. Frequent urination. 6. Unexplained weight loss, even though you're eating and feel hungry. 7. Fatigue. 8. Blurry vision. 9. Heavy, labored breathing. Your doctor may call this small respiration. 10. Frequent infections of your skin. 11. Urinary tract, or vagina. 12. Crankiness or mood changes. 13. Bedwetting in a child who's been dry at night and so on. Are you following? Okay. Now, signs of an emergency with type 1 diabetes. This includes A. Shaking and confusion. B. Rapid breathing. C. Fruity smell to your breath. D. Belly pains. E. Loss of consciousness, but this is very rare. Understood?
Yes, sir. Very interesting.
Any question before we continue?
No question for now, sir.
I believe there's no question from the back row too? Okay, let's discuss the next subtopic. Causes of type 1 diabetes. Insulin is a hormone that helps move sugar, or glucose, into your body's tissues. Your cells use it as fuel. Damaged beta cells from type 1 diabetes throws the process off. glucose doesn't move into your cells because insulin isn't there to do the job. Instead, it builds up in your blood, and your cells starve. This causes high blood sugar, which can lead to dehydration. When there's extra sugar in your blood, you pee more. That's your body's way of getting rid of it. A large amount of water goes out with that urine, causing your body to dry out. Weight loss. The glucose that goes out when you pee takes calories with it. That's why many people with high blood sugar lose weight. Dehydration also plays a part. Diabetic ketoacidosis, DKA. If your body can't get enough glucose for fuel, it breaks down fat cells instead. This creates chemicals called ketones. Your liver releases the sugar it stores to help out. But your body can't use it without insulin, so it builds up in your blood, along with the acidic ketones. This mix of extra glucose, dehydration, and acid buildup is known as ketoacidosis and can be life-threatening if not treated right away. Damage to your body. Over time, high glucose levels in your blood can harm the nerves and small blood vessels in your eyes, kidneys, and heart. They can also make you more likely to get hardened arteries, or atherosclerosis, which can lead to heart attacks and strokes. There's no way to prevent type 1 diabetes. Doctors don't know all the things that cause it. But they know that your genes play a role. They also know that you can get type 1 diabetes when something around you, like a virus, tells your immune system to go after your pancreas. Most people with type 1 diabetes have signs of this attack, called autoantibodies. They're there in almost everyone who has the condition when their blood sugar is high. Type 1 diabetes can happen along with other autoimmune diseases, like Graves' disease or vitiligo. I would like to round up the class here for today. But before then, let me attend to one or two questions, if there is.
No question, sir. Your teaching is very interesting, sir.
Good of you. We shall continue the class next week. While we shall study 1. Risk factors of type 1 diabetes. 2. Type 1 diabetes diagnosis. 3. Type 1 diabetes treatment. 4. Types of insulin. 5. Lifestyle changes. 6. Type 1 diabetes complications. Make sure you study ahead of the class.
Yes, sir. Thank you, Mr. Nelson.
Okay, bye.
Okay, sir.
Lydia, I'm very happy that I attended the class.
I told you in the morning diabetes is not sentenced to death.
Yes, you said it. Thank you so much, my dear friend. God bless you. Stop scaring diabetic patients in the society. Diabetes is not sentenced to death, as this can be properly managed. Thus, one constant of diabetes management is behavior. Behavior is a new implementing treatment for people with diabetes. Therefore, change your behavior.